It's absolutely everybody's responsibility, right from the board of directors all the way to front of staff at the reception. So not just down to the medical professionals or someone with accessibility in their portfolio.
I agree. I think it's the healthcare providers. It shouldn't be women with disabilities who have that responsibility to make sure services are accessible.
Accessibility is not just about physical barriers. It's about a range of dynamic factors, including trust, power dynamics, relationships, safety, communications. I think it's really important when you're talking about accessibility to consider disclosure, making sure that there's a safe environment to disclose issues if you need to. I think the relationship between physical and mental health is poorly understood. Just because someone is distressed or upset in a medical appointment does not mean they have a mental illness. Yes, it needs to be addressed and considered, but you need to make sure you listen to the other concerns.
I was in an emergency department quite a while back, and because I am on warfarin, which means I have regular blood tests, I had significant scarring on my arms. And the ED doctor asked me, am I an intravenous drug user? To which I said, no, I'm on warfarin, on blood thinners, which if she had read my chart would have been much more easy and she would know what was going on with me.
A lot of invisible disabilities can be chronic illnesses and they don't often qualify for funding, and this can be really, really hard to navigate, particularly if you're undiagnosed or kind of fit in some different categories. It can be really, really expensive. They also have really long waiting lists, which often don't have a lot of support. So you can be waiting months and months and months for service you may or may not need, and it's a really, really hard thing to navigate.
The other fun one, I think, with invisible conditions is that there is this sort of assumption that if you're looking okay on the surface, then everything must be going fine, you don't need any changes, you don't need support. And that isn't necessarily the case. And that can feel like that you're repeatedly having to disclose your condition and your support needs just to make sure you are getting the help that you're needing. There's invisible components to a lot of things, and then there also can be those visible moments that break through. And if something's showing up, particularly if you're out in public or something like that, you know, you can get some quite personal questions about your health and your body that aren't really appropriate to just walk up to a total stranger and ask. So, you know, if on a rare occasion I use a disabled parking spot, you know, I've occasionally had somebody come up and ask what my right is to be there and what's wrong with me, and well, it must all be in my head, which is an interesting space to be in.
I had an appointment early in the year, and my support workers realised very early on that I was uncomfortable talking to people sometimes, and I can be a bit forgetful when I'm stressed and anxious. So she said to me, would I like to go on the appointment with you? So I said yes. And she said, was there anything you'd like me to say on your behalf if you get stuck? So I told her what I did, summary of what I needed to tell the doctor. And because I had her supporting me, I remembered everything, which is a great feeling. One thing was said to me that was very, very unhelpful. I cannot read properly, and I went to see an optometrist who could not figure out why I couldn't read properly. When I told him, when he finally saw that I couldn't read because I had an acquired brain injury, he spoke to me like this. I was very insulted. I said, could you please lower your voice? He said, do you want me to lower my voice? I said, yes, please. I'm highly intelligent. I do not need you to speak to me like that.
When things are not working the way they were expected to, it's not helpful to be blamed for that. It's not your fault. It's not that you weren't trying hard enough or that you didn't want it to work. It's just not the right solution for you at this point in time.
Disability is full of diversity, and even those with the same disability experience it differently. Your health is just that, your health. It is important that your needs are known, and it is important that your needs are met.
Due to my vehicle my very obvious disability, staff sometimes make assumptions that can be totally wrong. And this is because of my speech. Some staff may think that I cannot speak for myself, but I deal with this by going to appointments by myself, having no support, so that the staff have to direct the conversation to me.
One of my invisible disabilities is that it takes me longer to process information. So I've learnt to ask for a copy of so I can go home and have a think about what sort of questions I might like to ask next time I see the health professional. I like to make a list of questions or points when I see my medical professionals, so I remember the issues that I need to talk about, and I feel more in control of the conversation and can collaborate with my health professionals.
I've learned over time to be assertive, to ask questions, make sure that I receive an answer that I'm comfortable with. No question is a stupid question, because this is all about my health.
Studying and researching a disability is completely different to living it. Health professionals can talk about the physical effects of disabilities, but they don't know how it feels unless they experience the emotional and psychological effects as well.
I have lived in my body for 60 odd years, therefore I am the expert of my own experience, and I know my body better than anyone else. Women with disability are often great managers, as we plan or act aspects of our lives. We have much knowledge and lived experience to share. When a health service consults with women with disability as other consultants, we must be paid for our knowledge and our experience. Gone are the days of volunteering our time, knowledge of the experience.
A woman with disabilities must feel safe, respected and included to enable the continuation of a working relationship that will lead to the best outcome for her and her health.
It can be quite frustrating. Living in the rural area of Victoria, because there are there is very limited access to healthcare services that are appropriate and accessible for me. To be proactive in managing myself, I need to access services such as physiotherapy. However, in my town there isn't a physio available, so that means travelling 2 hours away to the nearest therapist.
I think having a sort of a very welcoming environment wherever it is you're going, whether it be like a doctor's surgery or, even a gym or something, there's sort of a welcoming environment that you can sort of say, hey, people come up to you and say hello, and ask how you're doing. And even like the day call could be maybe welcoming too.
An important one for me is co-design. I think a healthcare service should involve women with disabilities in the design and maintenance of their services and involve them early. Why make a service for women with disabilities without involving and listening to women with disabilities? It's not going to be the right outcome.
And there are so many extra barriers to financial wellbeing and security that women with disabilities face. There's the higher cost of healthcare and of supporting a condition and a disability. There's the additional barriers to employment and education that have to be overcome. And as you said, having lived with your own body in that space of chronic illness or disability, it really is like you've got your own degree, because it is a full-time job in itself, and it should be recognised as another form of expertise, and it should be remunerated when that expertise is being utilised.
Yeah, it's not a tokenistic thing, it's not a checkbox. You actually listen and you're involved, they're part of the process, and it's going to be a much, much better result.
You can validate the experience that somebody's having and the challenges they're experiencing without being able to fix all the issues or even necessarily fully being able to understand it, which comes back to listening to what somebody's saying, accepting it as the truth, even if you can't find something on a test that backs it up, and maybe coming up with a few ideas with that woman on how you could reduce the impact based on their resources and supports, which means it's going to look different for everybody, even if it's the same issue.
It's also important that maybe if you don't have the answers, it's okay to say that you don't know, but you should validate the experience. If someone's experiencing pain and maybe you can't fix that, acknowledge their pain, talk about support and what those next steps might be.
It can't just be tokenistic, it needs to genuinely be involving women at every step of the process. And I think we can also work towards making workplaces more accessible by normalising flexibility, whether that's keeping some availability open to work from home arrangements or varying start and finish times to avoid peak hour travel, part-time hours, job share arrangements. There are many different ways that we can make sure workplaces are staying accessible at all levels.
Absolutely, and not looking at that as a burden, it actually can be an asset. I think it's really important to normalise flexibility in a workplace so that it is accessible for women with disabilities, and there are boundaries and things in place that can make being in a healthcare setting and working in a healthcare setting accessible and achievable.
And making sure you actually include the staff member with disability in everything. If there's a meeting, include the staff member, don't exclude them, because that means they're cut out of the loop and they don't know what's going on in the project.
And if you're not sure how to include them, ask, how can we make this more accessible?
Absolutely, Kate.